Great. Hello and welcome to another Supporting Client Health and Wellness class presented by the Far Northern Regional Center's clinical team. My name is Jen Badger. I'm a nurse with Far Northern. I work out of the Reading office. I also have with me today our two other nurses. If you guys want to turn your camera on and say hello. We have Katie Taylor from the Reading office as well.
Hi, and I apologize. My camera's not working today, but thank you for joining us.
And then also Nellie Camarena.
Hi, thank you everyone.
Hi, Nellie.
Hi.
Thanks for being here. Today, we have a great topic for you guys. I think you're going to really like it. Over there. Okay, we're going to discuss today thermoregulation and preventing heat-related illness. As you all probably know, it's been starting to get pretty warm in our area, and it's just going to get hotter, right? We have pretty hot summers here, so this is a pretty applicable topic to not only our clients, but also to everyone. So let's go for it. For the agenda, we're just going to go through these items. What is thermoregulation? Thermoregulation difficulties in developmentally disabled individuals. We'll talk about heat-related illness, heat exhaustion, and heat stroke, and just a little bit about heat doctor. All right, so what is thermoregulation? Thermoregulation is the body's ability to keep its temperature within certain boundaries, even when the surrounding temperature is very different. The internal thermoregulation process is one aspect of homeostasis. And what is homeostasis? That is a state of dynamic stability in a person's internal conditions. Our bodies are always striving to reach homeostasis, and thermoregulation is part of that. We want to be right around that 98.6. That is when everything functions the best. So let's talk a little bit about core body temperature. This is the ideal temperature for your internal organs to be able to function. The core temperature is maintained by balancing heat that's generated by the body's processes and heat that's lost. The core temperature of a healthy human being is going to be between 97.7 and 99.5, with the most common temperature being 98.6. A core temperature in that range is necessary for the body's metabolic processes to function properly. There's a lot of anatomy involved in thermoregulation, but the big ones are listed here. The brain is definitely involved. That's our control tower, right? The brain is making all those decisions and sending messages to the nervous system or through the nervous system to the body, and then receiving messages back. And then the brain is what's telling the body to make different changes to try and maintain that homeostasis. The skin is very much involved in thermoregulation, as are skeletal muscles, the sweat glands, our whole vascular system, the endocrine system, and the nervous system. So in the brain is an organ called the hypothalamus, and it's considered the thermostat of the body. It's this teeny tiny organ deep in the center of the brain. And it's the main link between the endocrine system and the nervous system. The hypothalamus receives signals from other parts of the brain and the body and produces hormones And those hormones control things like body temperature, heart rate, hunger, mood, the release of hormones from other glands in the body, your sex drive, how well you sleep, and your thirst. So how does the body cool off? The biggest thing, and probably the most noticeable, is by increasing sweating. Because when we sweat, the moisture that is on our skin, when it touches air, it dries. And when it dries, it causes a cooling effect. So your body will sweat to try and capture that effect using the moisture and the airflow. The body also uses vasodilation or vasoconstriction. And vasodilation is those small capillaries that are at the ends of your blood vessels and that are in like the subcutaneous tissues and really all of the tissues, but it's just those teeny, teeny capillaries. With vasodilation, those get really wide and that what that does is it allows more blood and fluid to be toward the periphery of the body, which allows it to cool more. And then that again decreases the temperature overall because blood is constantly circulating. Vasoconstriction occurs when someone is too cold and those blood vessels tighten up and try to push water or fluid or blood more toward the center or core of the body to maintain heat. Your body also can reduce its own metabolic rate in an effort to cool off. And then by making behavior changes, reducing movement. When you're really, really hot, it makes you want to slow down, find a shady spot and sit down and cool off, right? Because you even if you're not consciously thinking about it, your brain knows that the more that you're moving around, the more heat you're going to be producing. Adopting an open body position, spreading out your arms or your legs, that's going to help cool you off more as well. And then we can also like remove clothing and reducing the amount of food that you're eating as well. Because just the action of metabolizing and processing food that you're eating produces heat in the body too. So the appetite is reduced when we're feeling overheated. How does the body warm up? And there's that vasoconstriction, right, that we just talked about. Also, increasing the metabolic rate is going to go ahead and raise body temperature. Piloerection, which is just a fancy word for goosebumps. And you can see in the picture here, all the little hairs are standing straight up and there's goosebumps. And by doing that, your body is changing the surface area of your skin to allow your skin to get warmer and therefore warm up the rest of your body. Skeletal muscle contraction also warms up the body. So like exercising could be an example of a way to warm up, right? Sometimes if you're really cold, you might be like, wow, I got to get up and move around. I'm like really cold. But some of that is just simply shivering. And so that's like if you weren't able to get up and move around, then your body would probably just start shivering in an effort to cause motion that increases temperature. Behavior changes that we make to warm up would be increasing those movements, adopting a closed body position, like being curled up, or, keeping your arms in close to your body or your legs, maybe getting in the fetal position. That all of those things help you retain more heat. We add more clothes, we layer, and then increasing appetite or just eating food can make you warm up. So thermoregulation difficulties in developmentally disabled individuals is very, very common for our DD folks to have struggle with thermoregulation. And some of this comes from sensory processing issues, impaired communication and self-advocacy, limited mobility or physical impairments, underlying medical conditions, and medications and side effects. And we'll talk about each of these individually. So sensory processing is a complex function that involves collecting, integrating, and interpreting information from multiple sensory systems, including touch, movement, vision, hearing, smell, and taste. Sensory processing differences can make it difficult for some people to process temperature cues. For example, people with autism may have heightened or decreased sensitivity to temperature, which can make it hard to regulate their body temperature on their own. People with spinal cord injuries are especially at risk during high temperatures because of their inability to control their body temperature. Spinal cord injuries can lead to reduced sweating capacity as well. Sensory processing has a lot to do with how the body responds to external stimulus. In hot weather, a client with sensory processing difficulty might overheat more quickly or take too long to start sweating. However, these temperature regulation issues can present themselves in different ways. Clients may be more averse to either hot or cold weather due to hypersensitivity. They may also experience changes in their core body temperature due to changes in outside temperature. They may also feel cold when others around them are not. Hyposensitivity or low sensitivity may also lead to temperature regulation issues. Some may not feel the temperature differences in their bodies or the weather. This could lead to some clients refusing to wear proper seasonal clothing because their bodies don't recognize the changes. Some common indicators of temperature regulation issues include extreme reactions to temperature changes, such as excessive sweating or shivering, resistance to wearing weather-appropriate clothing, or an inability to express discomfort verbally. Their behavior may change. They may not like the way clothing or sweat feels on their skin. Their body may prefer the cold or the warm. Consider that if you're too warm or too cold, it leads to discomfort. This is true of your clients as well. While some may be able to communicate this discomfort to you through words, others may be telling you in other ways if they're unable to speak. This can lead to us having to react differently for them regarding warm weather, air conditioning, or anything else that affects temperature. To support temperature regulation, it's essential to provide comfortable clothing options, access to cooling or warming tools, and spaces where individuals can easily regulate their proximity to heat or cool sources. This proactive approach helps minimize sensory challenges related to temperature. Right, impaired communication and self-advocacy. People with cognitive, intellectual, or developmental disabilities are at risk because they may have trouble understanding and communicating how the heat affects them. This can prevent them from taking protective actions. It's important to know that a person's ability to perceive or communicate physical discomfort may vary. Individuals with developmental disabilities may use nonverbal behaviors such as facial expressions, muscle tension, breathing patterns, body movements, and eye gaze to reflect their needs, wants, and feelings. These nonverbal behaviors are involuntary or reflexive responses to the sensations the individual is experiencing internally and or in response to what's happening externally in their environment. These clients depend on their caregiver to recognize, interpret, and respond to their behavior. A client's communication behaviors may be subtle, non-conventional, and inconsistent. This can often result in the caregiver having difficulty recognizing and interpreting the meaning of the behavior and responding to those behaviors consistently. In addition, the individual may develop challenging behaviors such as self-injury, self-stimulatory behaviors, and withdrawal or isolation. High staff turnover or use of minimal staffing can lead to missed communication and individuals progressing to heat-related illness that could have been prevented. Limited mobility or physical impairments. Mobility is the ability of a client to change and control their body position. Physical mobility requires sufficient muscle strength and energy, along with adequate skeletal stability, joint function, and neuromuscular synchronization. Functional mobility is the ability of the client to move around in their environment, including walking, standing up from a chair, sitting down from standing, and moving around in bed. People with mobility constraints are more vulnerable to extreme temperatures. People with physical impairments and cognitive deficits are especially at risk during heat waves. Limited activity can reduce sweating, which can negatively impact the body's ability to adapt to heat. Some people with disabilities may need accessible public transportation to access cooling centers and cooling center facilities to be accessible. Extreme heat events can cause people to be stranded in their homes unexpectedly, where they may, in some situations, such as a blackout, experience deadly indoor temperatures. Underlying medical conditions. Certain developmental disabilities, such as Down syndrome, can be associated with underlying health conditions that affect thermoregulation, such as thyroid dysfunction or heart conditions. Many chronic health conditions can make people more vulnerable to heat, and those include heart disease. Heat may increase the chances of heart attacks, heart arrhythmias, and heart failure. People with heart disease should create a heat action plan with their doctor. Another one is obesity. People who are overweight or obese tend to retain more body heat, putting them at a higher risk. Respiratory conditions. Heat can worsen asthma, COPD, and other respiratory illnesses, especially when combined with air pollution or smoke. Anyone with asthma, especially children, may find it more difficult to breathe on hot days. Some evidence suggests that inhalers stored in extreme heat may not work as well, possibly dispensing less than a full dose of medication. Heat can irritate the lungs, causing flare-ups for adults who smoke or have asthma or COPD, even for those spending most of their time indoors. Heat also increases ozone air pollution and the risk of dehydration, both of which can make breathing more difficult. Another medical condition that affects thermoregulation is diabetes. People with diabetes have higher rates of heat illness and death during heat waves. People who have type 1 or type 2 have a harder time regulating body temperature and blood glucose when it gets hot out. Extreme heat can also damage insulin, insulin pumps, and glucose monitors. So that's something to keep in mind if you are going on outings with clients, that we don't want to be leaving inhalers or their insulin or diabetes testing equipment, like sitting in a hot car, for instance. Another condition is migraines. Migraines can be triggered by dehydration, excessive heat, and brightness. People with fibromyalgia can react strongly to heat, along with pressure, sound, and light. And conditions such as rosacea, high temperatures and ultraviolet rays are common triggers for rosacea, a chronic inflammatory disorder that causes the skin to flush and be hypersensitive. And I'm going to talk more about the Parkinson's disease and stuff here in a minute. Sweating is one of the body's best tools for regulating body temperature, but it can lead to dehydration, which is a major culprit in heat-related illnesses. A disruption to the balance of water and electrolytes can trigger headaches, cause elevated blood glucose levels, and reduce kidney function and blood pressure. Research is finding that exposure to heat over time, or even a few months, can cause long-term damage to the human body and maybe even increase the likelihood of developing some chronic conditions such as kidney disease or respiratory disease. People with cognitive deficits don't realize how vulnerable they truly are. On extreme heat days, ER visits for mental health diagnoses increase, and specifically for people with substance use disorders, anxiety and stress disorders, mood disorders, schizophrenia, self-harm, and many others. There's strong evidence for more instances of suicide, homicide, and violent crime on extremely hot days. Heat may also influence symptom severity in people with mood disorders and schizophrenia. One way that heat disturbs mental health is also by interrupting sleep. And this is a new slide for this class, and I wanted to talk a little bit about dysautonomia. You may or may not have heard that term before, but dysautonomia or autonomic dysfunction is a disorder of the autonomic nervous system, and it can impair involuntary body functions like heart rate, blood pressure, digestion, and thermoregulation. I wanted to put together a quick list of diagnoses that can commonly include dysautonomia. And wow, like there wasn't really a short list at all. There's a lot of different things that can cause an individual to have dysautonomia and thermoregulation issues. Basically, if you read the line at the bottom, any disease or disorder that affects the central nervous system, so that's the brain, the spinal cord, or the brainstem and the spinal cord, those are all in the central nervous system. And any disease or disorder that affects the CNS can cause dysautonomia, which would also often include thermoregulation issues. I'm not going to read through all these, but you can take a screenshot if you. Okay. Medications and side effects. Some common drugs, including anticholinergics, certain ACE inhibitors, diuretics, beta blockers, antidepressants, antihistamines, stimulants, and antipsychotics, can increase the risk of heat stroke by interfering with the body's ability to regulate its temperature, fluids, or electrolytes. And here you can see that some medications like diuretics and ACE inhibitors can reduce the thirst sensation. So someone may be thirsty, but may need to drink more water, but they aren't feeling thirsty. And so that's pretty common, a pretty common side effect. But antipsychotic medications and stimulants, and again, anticholinergics, can also interfere with central thermoregulation, which is basically it's affecting your autonomic nervous system and interfering with that function. Impaired sweating and impaired cooling can also be caused by selective serotonin reuptake inhibitors, or SSRIs, SNRIs, and can be decreased with tricyclic antidepressants. Typical and atypical antipsychotics and anticholinergics also can impair the ability to sweat. Also, drugs like diuretics and beta blockers and tricyclics and any laxatives, those can all increase the risk of suffering from volume depletion or low blood pressure and reduced cardiac output. So basically, the blood volume is low. It's like the same as being dehydrated almost, right? So some drugs can definitely cause that lower blood volume, low blood pressure. And the result of that, of course, is the risk of fainting, of falling, potentially less blood flow to the kidneys, and which can lead to, of course, in worst cases, renal failure. But certain nephrotoxic drugs can also cause renal injury when the blood volume is depleted, because by having less volume in the blood, but the same dose of medication, what you end up with is a higher concentration of the drug in the bloodstream, and that can lead to increased nephrotoxicity of those drugs as well. And that also can be caused by NSAIDs too. So things like aspirin and ibuprofen. Okay, so let's talk about heat-related illness specifically, and heat exhaustion and heat stroke. So there are multiple heat-related illnesses. The least of these is a heat rash. A heat rash is a skin irritation that's caused by excessive sweating and clogged pores during hot and humid weather. It's very uncomfortable to get a heat rash, but a heat rash in and of itself is not a super dangerous thing. It just means that, you need to cool down and get yourself feeling better. Heat cramps can also occur, especially if someone sweats a lot, because when you sweat, you're losing salts, fluids, minerals, and electrolytes. It's all coming out of your pores. If only the fluids are replaced, in other words, the person's just drinking straight water, but they're not replacing those salts and minerals and electrolytes that are being lost, that's when painful cramps can happen. And heat cramps, although extremely painful, those are not super dangerous. But again, it's kind of a precursor to some of these more serious issues. And the next would be heat syncope or fainting. People who stand for long periods or suddenly get up from sitting or laying down while overheated are much more likely to experience dizziness and fainting. And that's because when you're overheated, you're vasodilated, which lowers the blood pressure. So you already have a low blood pressure, right? And then if you stand up too fast, especially if you already are someone who has orthostatic hypotension, where you get dizzy when you stand up, then there's a pretty good chance that you might faint from the shift in your blood volume and the lack of vasoconstriction to raise your blood pressure and keep you from losing consciousness. In both cases of dizziness or fainting, fainting is caused by a lack of adequate blood supply to the brain. Dehydration and lack of acclimatization to warm or hot environments can increase the susceptibility to fainting. Victims normally recover consciousness rapidly after they faint. So again, not as much of a serious situation. However, if somebody in your care ever has a syncopal event or they faint, they lose consciousness and, fall to the ground, that is definitely a reason to take them to the emergency room, because there's a lot of different things that can cause fainting, and we definitely want to make sure that they're okay and that we've checked them out for all of those possible reasons. Okay. So the two ones that we really want to be careful and really, really want to try to prevent is heat exhaustion and heat stroke. Heat exhaustion is the body's response to an excessive loss of water and the salt contained in sweat. And heat stroke is usually fatal unless emergency medical treatment is provided right away. And that's just heat exhaustion that got worse. So what are the signs of heat exhaustion and heat stroke? So with heat exhaustion and heat stroke, you're going to see sweating, but sweating more with heat exhaustion. Once you get into the stroke phase, the sweating stops. But if someone's heading towards either of these, they're probably going to be sweating, they're going to be flushed and red. Their heart rate will be high because their blood pressure will be low. They're usually lightheaded because of that low blood pressure and fast heart rate. They may have a pretty significant headache, and their skin might feel weird, like bugs crawling on it, or weird sensations that are also known as paresthesias. They'll probably feel very weak, very fatigued, tired, have some of those muscle cramps. They may have low or no urine output. Or their urine, if they do have urine output, it's probably going to be very concentrated and dark. They might get nauseated. They might even be agitated or, angry or just touchy because they're not feeling well, primarily. That low blood pressure is going to be a hallmark. And then, of course, if it gets really bad, they could have syncope and faint. They may be super confused or even delirious. And Unfortunately, if it progresses to heat stroke, they are at a significant risk for having seizures and also could end up in a coma. I do want to also add, I know I put nausea here, but one of the big signs of an emergency with heat stroke is if they suddenly start vomiting in the middle of all of this. And this is just a great little slide that I pulled off of CDPH's website. This would be a good one to have printed and like put up, at the house or have it in the Go binder so that, staff is reminded when they're out, especially in the summer, to watch for these things. And it really divides up heat exhaustion and heat stroke. When somebody is having the symptoms of heat exhaustion, what do? We want to move them to a cooler place. We want to loosen up those clothes, get more airflow on their skin. We can put cool, wet cloths all over their body. We can have them take a cool bath. And we want to have them sip on water. Again, don't chug water because that could lead to the throwing up. And it says here, if they are throwing up or symptoms get worse or they are not getting better in an hour, then they need to get some medical help. If you see someone who has signs of a heat stroke, then we want to call 911 right away. A person with heat stroke, they are going to have a very high body temperature. If you take their temp, it's probably going to be like 102 to 104. Their skin's going to be bright red, very hot, and they're not really going to be sweating like they were maybe a little while earlier, right? And then you're going to probably see like the vomiting and stuff. And they may be very confused. They may be very out of it. And that could be, a precursor to being unconscious. So we want to get them help immediately because, as I said earlier, heat stroke is usually fatal if someone doesn't get help right away. Again, in the meantime, while you're waiting for EMS to show up, we want to get them out of the heat, get them indoors in a cooler place or in the shade, and put the cool, wet cloths. You can get a towel wet. If you've got a water bottle, just dump it on a towel or on their clothes, get their clothes all wet. You can cover them with that, drape the towel over their head, whatever you can to get them cooled off. And then here it advises that at this point, you don't want to give them anything to drink. So that's something that if they're this sick, we want to just not do that. We just want to go ahead and cool them off as best we can and wait for EMS to get there. Heat stroke first aid. So, like I said, get out of the heat and move to a cool place. You can lay them down, elevate the feet. Elevating the feet helps bring blood back to the body and the core part of the body, and it can help them cool off a little better. You want to take off any clothing that's tight or that's like thick and hot. You can put a fan on them to try and cool them off. That's going to be really helpful, especially if you're getting their skin nice and damp and wet, and then you have the fan blowing on them at the same time. That's going to help. If you don't have a fan because you're out somewhere, you can, take something and just fan them with your hands or with a shirt or whatever to try and get them to cool down. Applying cold compresses to their skin. The best place to put something really cold is under the armpits, up in there and in the groin area. So you can use, even if you just have like cold water bottles, you can put a water bottle under each arm. That's a good way to cool off the body because you have large blood vessels going through those areas, and that helps cool the blood off as it's going by. And then this says have them drink fluids. Of course, the last slide said if they're already in actual heat stroke phase, that you would want to hold off on fluids. I think I think probably just the standard, like of just have them sip some fluids is probably the safe middle ground there. But definitely make sure that we are calling 911 immediately, and then doing all of our measures while we're waiting for them to show up. And here's some great pictures of people who got overheated and they're getting some help. So this nice lady, got really hot. She's laying down. I don't know. I probably would have moved her over here in the shade or somewhere, but he's given her some nice cold drink to cool her off. This guy, he's all the way in a tub. I mean, the chances of you having a big tub where you're at might be pretty unlikely. But if you're at home, you do have access to a bathtub, and a nice cool bath would be helpful. This young man, they're just surrounding him with some ice. This guy's got the ice packs. Again, this is great. Behind the neck. Oh, that feels so good. And under the arms and in the groin area. And like here, this firefighter, I guess, got overheated and they're trying to move him, but they're taking extra precaution and making sure he's shaded even while they're just carrying him out to where the truck is, which is really smart because otherwise he might still just be getting warmer and warmer. So who is at the highest risk for heat-related illness? Well, it's people with chronic diseases and disabilities, right? Those are the folks that we work with. So they are definitely at a high risk for heat-related illness. Also, our young children and older adults, people who work outdoors because they're out in the heat for long periods of time, and they're also spending a lot of energy, which will keep their own body temperature higher because they're moving around, they're working outside. People who are unhoused, our homeless folks really struggle in the summer. It's very hot out there, and especially if they're like in town where everything's all concrete and pavement, it can be really, really hot out there. So they are definitely at a high risk. And women who are pregnant are also at a higher risk. And part of that is from having more blood volume. Part of that is from just having more weight, and so they are retaining more heat. And some of it just has to do with being pregnant too. So what do we do to prevent heat-related illness? So we don't want to get to the point where we're having to ice everyone down, right? We would like to prevent it to begin with. So the first thing you can do is stay cool. And during the hottest times of the day, which is usually around 3 or 4 p.m., it's a good idea to make sure that you are in a cool place. People who don't have air conditioning should visit a local cooling center or public location, such as a library or a mall, as a way to get out of a warm environment at home. If they don't have AC, they can go to those places to cool down. Avoid physical exertion or exercising outdoors, especially during those hottest times, right? So, like if you guys are planning activities with clients and, it's beautiful weather, you want to go outside and do something. If it's something more physical or exertional, probably best to do it earlier in the morning or late in the evening as opposed to in the middle of the day in the summer. Also, wearing lightweight, light-colored, loose clothing can be very helpful in keeping cool. Wearing a wide-brimmed hat that's going to keep the sun off of your face or your shoulders or your back. Sunglasses and sunscreen. I'm not sure how much those help with staying cool, but they do help prevent sun damage to your eyes and skin. We want to stay hydrated, so drinking plenty of fluids, especially water, even when not thirsty. And it's important to remember, our clients have physical disabilities that are pretty much all related to their central nervous system, which means there's a chance that the clients you're working with are not only have altered thermoregulation, but they may not feel thirsty that easily. They may not really recognize that they need to drink. So it's up to us to encourage them and give them reminders, and also to be monitoring how much they do drink so that we can catch if they're not drinking enough and make sure that we're trying a little harder to motivate them. Drinking low sugar sports drinks, alternating with water, will help replace electrolytes that are lost. And this says if you're engaging in vigorous exercise, but the reality is that you can lose electrolytes from sweating of any kind. So if you're sweating, you're losing some electrolytes. And so it's helpful to do sports drinks. They emphasize low sugar here because, of course, we know high sugar drinks are dehydrating. So we want to avoid high sugar drinks, alcoholic beverages, and energy drinks, because what's dehydrating? Sugar, alcohol, and caffeine. So we want to avoid those things, and then also drink the water and electrolytes, and then hopefully we'll be good and hydrated, right? And we can eat fruits and vegetables, and that also helps. Stay connected. Check in on those who are at high risk of heat-related illness, including infants and young children, people 65 and older, and individuals with chronic illness, disabilities, or who are pregnant. So we want to make sure we're checking on those folks. If you have older parents or family members or friends, check on those folks on these really hot days that we get in the summer. We want to make sure that everyone is safe and healthy. And you can use a buddy system when you're working in the heat. And that would be having a pal who, you guys are both checking on each other. Maybe you're giving each other reminders to, hey, time to drink your water, that kind of thing. Just making sure that you're checking on your people and that you've got someone checking on you. And then staying informed. It's a good idea to check local news for weather forecasts, extreme heat alerts, and cooling centers and locations of those. I know we all have our cell phones, and I go on my weather app all the time, every day. And in the summer, especially, I like to look ahead for like the full 10 days so that I have a good idea of when we're going to be hit with really high temps. And I can make sure that I'm planning accordingly. But for you guys, when you're working with clients, you really need to kind of keep an eye on that stuff, especially when you have like planned outdoor activities that may need to be rescheduled or adjusted to make sure that we're keeping those clients safe and we're not taking them out to the lake when it's 115 out, and they could be at risk for getting heat stroke. There's also the 7-day heat risk forecast, which is helpful too. So the caretaker checklist. Keep a close eye on those in your care and ask yourself these questions. Question 1, are they drinking enough water? Number 2, do they have access to air conditioning? Number 3, do they know how to keep cool? If you find out that you have a client who does not know how to keep cool or isn't very good at following how to keep cool, then that prompts you to take some steps to try and improve that so that they can do better. And then question 4, do they show signs of heat stress? And of course, you're not going to know if you don't know what the signs are. And all of you are going to know what the signs are because you're all here today, but not everybody is here today. So please share that information with your coworkers, with your staff, and with your clients. And even with their home caregivers. So if they're going home to family members or others who provide care for them, maybe outside of the regional center, make sure everybody knows what those signs are to watch for and what they can do to help prevent heat-related illness. Because it's not just us, right? Everybody needs to be aware. Everyone involved in the client's care should know these things. And then just a little bit on heat.gov. So heat.gov is a website that's put out by weather.gov, which is also, I think, affiliated with the Weather Channel, right? So they're all kind of linked. But heat.gov has the heat risk map, and you can go on there and it will show you the combination of weather, climate, and CDC data to identify potentially dangerous heat that might lead to an increased risk of health impacts. And it's designed to help you understand what the forecasted heat means for you and what actions you might need to take. So here you can see on this map, it gives you the colors and what they mean, and you can see exactly which areas are the worst. And surprisingly, on this map, we're looking really good. But usually all of these colors are over here where we live, right? So it's just a good way to reference what you can anticipate in the coming days as far as the weather goes so that you can be prepared for heat in your area. All right. So I am so grateful that you guys came today. This is a really important training. I want to make sure you have a minute to ask any questions that you might have regarding how to stay safe in the heat. I'm going to look at the chat and just make sure I didn't. Okay, there's no questions there. Does anyone have any questions for me about what we talked about today? Everyone's so quiet. Okay, well, that's all right if you don't have questions. If you do think of anything, though, our information is on this slide, so feel free to note this. We have Nellie and Katie and myself. These are our direct phone numbers. So those are nice to have. You don't have to necessarily go through the receptionist. Also, our emails are on here and the fax numbers too. So if you guys ever run into questions, concerns, want to just clarify something that we talked about in class, feel free to reach out anytime. We are more than happy to help.